supplies, we're going to be doing a blood collection using venipuncture. First thing we're going to do is gather our supplies, check our expiration, and check our orders. We're going to perform hand hygiene and don our gloves. Then we're going to verify our patient name, date of birth, and allergies, as well as check our specimen label against our patient ID bracelet. If they match, we're going to explain the procedure and ask any questions. We need to close the curtains and the door to make sure that the patient has privacy during the procedure. We're also going to assist the patient into a comfortable position and assess if the patient has had a mastectomy, fistula, or has a contraceptive implant on that side. Then we're going to start to assess our veins using palpation to determine the best puncture site. Then we're going to apply our tourniquet 3 to 4 inches above the anticipated puncture site and then assess the vein. Then, after we determine that that is in fact a good puncture site, we're going to release the tourniquet and ensure that the vein decompresses. Then we're going to set up our supplies by opening the needle and attaching a vacutainer, or in this case, it's already pre-attached. So we're just going to grab our alcohol swab and clean the patient's skin for about 30 seconds in a circular motion. After we clean, we want to be sure we're not going to touch that area anymore. We're going to allow the skin to dry completely. We're not going to blow on it or wave our hands to dry it quicker. We're going to reapply our tourniquet that 3 to 4 inches above the puncture site and position and stabilize the patient's arm with our non-dominant hand. Then we're going to grab our vacutainer and needle with our dominant hand and position the blood specimen tube near the vacutainer, but we're not going to attach it yet. We just want to have it ready for when we do insert the needle. Then we're going to inform the patient that there's going to be a little bit of a pinch, and with the bevel up, we're going to insert the needle at a 15 to 30 degree angle, and we're going to push it in until we see a flash of blood. Then we're going to push that first collection tube into the puncture device until the rubber stopper on the collection tube is punctured. Blood will flow automatically, and as soon as we see that blood flow continuously, then we can remove our tourniquet. Then we're going to hold the needle and our tube in the vacutainer securely until we get all of our specimens collected from multiple tubes if needed. Then after all of our blood specimens have been collected, then we're going to remove that final tube and place a gauze pad over the puncture site while we slowly remove the needle from the vein. We're going to make sure to engage our needle guard and dispose of the needle properly into the biohazard red container. If the patient needs a Band-Aid, we'll apply a Band-Aid. We're going to remove our gloves and perform hand hygiene.